Are there false positives and false negatives? And if so, how common are they?
There certainly are false positives and false negatives. And let's deal with the false positives first, because this comes up in allergy in general. We call it sensitization. That is someone who has detectable IgE, but no allergic signs or symptoms. So, for example, if you screened, say, 100 third graders for peanut IgE, probably 15 of them would test positive. Of that 15, maybe only 3 or 4 would actually have symptoms after eating peanut. So we would call those 11 or 12 people who test positive but have no symptoms, we would call them sensitized but not allergic. The same can happen with AGS, where people, especially amongst our outdoor workers, they may have a history of tick bites and they may test positive for alpha-gal IgE but have no symptoms whatsoever. Equally, on the false negative side, we have patients who we see that have documented reactions that both they report and that we can reproduce in the clinic by having them consume some beef or pork, and yet they test negative. I think that the false negative rate amongst our cohort is around the 3 to 5% range. That's preliminary, and I haven't confirmed that with others. In terms of the false positive rate, that's probably much higher. It's probably in the order of 10 to 15% who may test positive but have no symptoms.